Hi everyone. So yeah, it's been a while, but let's get into this. So this video is for healthcare assistants and nurses from overseas. If you want to come to the UK, I'm sharing care worker jobs that have visa sponsorship as well as nurses. Okay, so let's dive deep into it. So first things first, a lot of people have been asking about, we hear they've stopped recruiting in the UK. So there's this announcement which just came up on 1st of June, 2023, which is like a few days ago. Today is 14th of June. Okay, a summary of some key data recently published with a focus on nursing vacancies. So latest NHS workforce and vacancy statistics. Okay, let's look at some numbers. NHS Digital has published the latest NHS workforce data, including data on nursing increases and vacancy statistics for the NHS England. I don't know where people are getting information about UK stopping to recruit. So this is why this had to come in. Let's get all your worries and doubts out of the way. The report shows that the NHS workforce has continued to grow with notable increases, mainly due to the volume of international recruitment. There has also been a small fall in the overall vacancy figures to 112,000 from a peak of 130,000 in December. Further details on workforce data can be found on NH Digital website. We're not going to go there because we just want this summary. Let's, can we move this? Oh God, I'm only making it bigger. What did I do? Okay. All right. So it says on here, the number of nurses has increased by around 12,000. Let's just get rid of it. Okay, yeah, has increased by around 12,000 within the past year, and most of the growth in nursing has been in hospitals. Recruitment of mental health nurses has been much slower despite long-standing staff shortages in mental health. So there is still a huge shortage in mental health nurses because they haven't been able to recruit as much as they require, and therefore there's a long-standing staff shortage in mental health nurses. There has been a little growth in community nursing or midwifery as well. So the NHS is currently on track to meet 50,000 new nurses promised if international recruitment continues at current pace. Okay, so if they had stopped, this would not be the case. As a result of this, the vacancy rate has fallen slightly to 9.9%. with 40,000 nursing posts remaining vacant. Okay, 40,000 posts remaining vacant. As well as the retention is the issue in the NHS at the moment. Retention, although still remains a key issue as leaver rates remain historically high and the NHS continues to lose experienced long-serving staff. Retirement is currently the main reason, with an increase in staff retiring early than planned. So retirement as well. More data is available in the nursing midwifery annual report, which also includes a detailed, okay? So I'll put all these websites in the chat for people who are doubting. This is talking about NHS alone statistics. So, and the NHS uses various agencies and all of this and all of that. So no, they haven't stopped recruiting. Okay. Here's another one, which are recruiting. So work with us here. The focus will be on sponsorship, what they are saying about sponsorship. But let's look if they have vacancies first. Current vacancies. as the UK's largest charity, blah, blah, blah. I think this is in full, I think it's Methodist homes, something like that. Okay. So they have a lot of vacancies, registered nurse, well-being, blah, blah. 46 pages of this. We can try the search, care and support, I guess. Let's try care work, search. Care assistant days based at this, that, and the other. So why I'm showing you this is that when you're applying, you need to have an idea of the job you're applying for. So in this case, this is the care home where you will be based in Oldham. I guess this is Manchester. They posted just today, 14th of June. Closing date is 10th of July, 2023. And so you need to understand what they are saying about the job before you can apply, because yeah, everything has to be in sync. You cannot be talking only about maybe engineering degrees, while what they are looking for is not an engineering degree. They're looking for something else. So that's why the emphasis is on. So let's go back to the sponsorship thing that we need to look at. So come back here, sponsorship. We are working with MMA healthcare recruitment in supporting overseas nurses and care assistants with relocating to the UK. Apply here, or read all of this and apply here. There's a clause here about the red and amber list. Regrettably, if you come from a country that has been added to the World Health Organization's red list, MHA will be unable to help you secure employment in the United Kingdom. Please refer to the following link for additional information on countries on the amber and red list. I think we've talked about this for a long time, but you can always check on here. MHA is working in partnership with MMA, a healthcare recruitment, the famous one, who have over 21 years of experience in supporting overseas nurses and care assistants with relocating to the UK. If you have already completed the NMC registration requirements and are interested in discovering your next career move with MHA, we want to hear from you. Complete our international nurse application form, and in your profile and or experience, meet the requirements of one of the current vacancies. A member of the international recruitment team will be able to will be in touch to discuss this further. So this is why I was talking about, you have to have an understanding of what job vacancies they have, look at what they want, so that when you're applying, it matches with what they are looking for. So once you have decided, apply here, will take you to MHA International Recruitment, and the WhatsApp number, the country where you currently live, yada, yada, yada. Country of training, closest airport, yada, yada, yada. Okay, so that's that. Let's move on to the next one. Okay. There has been an update. This is not a job offer, but it's an important announcement for people who are preparing to come to the UK, because English language requirements and tests is the thing. Okay. So this is an update from Nursing Midwifery Council, an update on changes to our English language requirements. I'm writing to update you on changes to our English language requirements that were agreed by the council. So you can always click on all these hyperlinks if you want to get the backstory, because here we're just looking at the update. There has been other things going on before. We started implementing the changes in February 2020, and I'm pleased to let you know that from next week we will have completed implementation. So this article came out, is there a date here, but let's see, end of May. Okay, there's no date here, but definitely it's quite recent from the source where I got it. This one I had to include it. So So applicants will be able to find out how to submit supporting information from employers by logging into NMC website. We know some applicants have already sent us supporting information from the employers using the previous manual process. Those applicants do not need to do anything different. The applications will continue. Okay, we now manage this process through NMC Online to give us assurance of the authenticity of the information. So to me, this sentence means like they must have been dealing with something, because the issue of authenticity, to give us assurance of the authenticity of the information, it means something was not adding up, maybe somewhere. And so things had to change. Okay. These changes should support more skilled, international educated professionals to join the NMC register and make a welcome and vital contribution to people's health and well-being in the UK. Okay, the changes we have made will maintain the high standards of English language that professionals need to demonstrate while making sure our processes are as fair and proportionate as possible. They will help to assure that our processes are free from bias and that we can verify the information that we receive. So verification of the information they receive, but as well as getting rid of any bias, if at all. Okay, so that was the announcement. Let's go into more jobs. Okay, so Barchester. Technically, they are saying they have 1,229 jobs. Barchester is one of the biggest care home companies. Yeah, I think it has over 260 homes across the UK. So yes, they have over 1,000 jobs. And if you click on any of it, it will talk about offer to pay tier 2 visa application fees for eligible nurses. Okay, this last sentence here. So you can apply any job that you want, and deadline is 30th of July, 36 hours guaranteed, days or nights all available. But there's a specific form for international, like we've looked here, over 1,000 jobs. But for people who haven't completed registration as a nurse, who want to come as pre-registered nurses, let's look for the opportunities. Okay, so there are 13 pre-registered nurses, and these were posted today as well, 14th of June 2023. Closing date is in 30 days, 13th of July. Okay, so let's also look at these pre-registered. That this in Cheshire is £18.75 an hour. When you go to Surrey, it increases a little bit with a few pences to £19.50. In Cornwall, it's £19.75. Probably somewhere else is £20, definitely. In Yorkshire, North Yorkshire, £20.70. Okay, so I guess the most of these are saying permanent, mixed days and night, pre-registered, but let's look at the requirements. Okay, what are they saying? As a pre-registered nurse at Barchester, we will look to you to create a safe and supportive environment for residents with a range of physical and mental needs. You can expect to be supported by us in working towards your PIN, whilst working with an experienced team of clinical, yada. So all of this, if people are nurses but they don't want to come here as nurses, and they will complete the process here, these are the jobs to apply, pre-registered. We'll post also link in the chat. So how do you apply? You can click on here or at the bottom, but their form I've tried a couple of times. It's a bit tricky. At times it comes up, at times it doesn't. So it depends on if you if you walk around with luck, I guess. But yeah, so this is the international form that you're gonna use. Do you require a certificate of sponsorship to work in the UK? Yes. Do you have a location preference? If you have already looked at the pre-registered nurse jobs or whatever, and you prefer, okay, because Lorraine lives in Coventry, I want to go in to Coventry, then this is the place to indicate. Where in the UK would you like to work? Please don't put Coventry. It's just it's just me being naughty. Let me stop sharing because I think yeah. So yeah, that's it for today. Please watch more videos and please subscribe here. You click here to subscribe, okay? Bye.